Another thing that came up through the pandemic was the burden on clinicians. And this is something that AWS has weighed into with various tools, with voice, with personalization tools, with trying to make the systems easier to access and reducing the friction of the whole transaction. Talk a little bit about the provider experience and what technology has been able to do and what we hope to do.
Yeah, this issue of sort of provider experiences is so heavy on all of our minds. To answer your question, Bill, it wouldn't be really hyperbolic to say that the need to streamline clinical workflows and plan staffing times and predict and reduce burnout are just table stakes for all of us. And we need to come together to figure these things out so that clinicians can focus on patient care, work top of license, and really do what they were trained to do and are passionate about doing. Cloud-based solutions can really help that. Things like automated speech recognition can give clinicians quick access to information they need and at the same time reduce the burden of data entry. We've seen customers deploy voice technologies to help with time-consuming, labor-intensive, and other really inefficient tasks and functions. Hawaii Pacific Health began to deploy over 600 Alexas at the bedside in their hospitals and use multiple Alexa skills that help to streamline provider and nurse to patient communications. They were able to really transform for the patients the in-room experience. And at the same time, the nurses could be freed up because they were no longer being called to administer in-room amenities and entertainment options and answer questions that Alexa in fact could do. And so those were some things that really delighted both patients but also providers in the context of what they were doing.